So tell me about the winter heart attack. I got that question. A friend of mine called Tony Geftos, who works at 13ABC, called me the other day and he's like, hey, is there any truth to the winter heart attack? Like if people go out and shovel, can they actually have a heart attack if you're shoveling snow? So the question obviously is yes. And he came over. We did a bunch of videos. But before we started, he was like, let me get some B-roll. For those of you who don't know what B-roll is, it's like video of you doing stuff related to the story he's about to tell. So he's like, let me get B-roll of you shoveling snow. So I start shoveling snow outside, and he's like, before it gets dark, and he turns his lights on, and I'm shoveling, and I'm shoveling, and I'm shoveling, and he's getting angles from this side and angles from this side, and backwards, forwards, off the ground, all these different angles. I'm like, Tony, you're going to give me a heart attack, man. I've been out here shoveling for like half an hour. Do you think you have enough B-roll? And so he did, obviously. But anyways, it was like a 12-minute interview. It was pretty awesome. The amount of it that they used for the newscast was only probably 2 minutes long. It was a nice segment. It was a good segment. Lots of people heard it and told me that they learned a lot from it. So I wanted to go over that whole thing because a lot of people didn't hear it, or YouTube's a completely different audience. I can reach people all over the world here rather than just ABC news. So yeah, heart attacks do happen more often during winter. And there's a few reasons. Number one, people are more sedentary and they're not used to exerting themselves in the winter, and now they suddenly get up and start shoveling snow. And shoveling snow is a hard activity. You can't just like get up and start shoveling. It's kind of like running a marathon. You don't just like get up and start running a marathon. It's a lot more involved. So you can't just like be completely sedentary in winter and then go outside and start shoveling snow. You got to stretch and warm up your body, do some jumping backs, maybe do some endurance training. Hopefully you've been doing that all winter long, but if you haven't, you probably really shouldn't do that. The second reason is when it's cold outside, your blood vessels constrict. One of the ways that your body protects its body heat is it constricts your peripheral blood vessels, especially in your hands, arms, feet, face, nose, and from that vasoconstriction, it can also constrict your coronaries. So that's another reason. If you have blocked arteries to begin with, and now you're going outside in the cold without really protecting yourself, you're not wearing a hat, you're not wearing gloves, especially like your peripheral, your nose, your ears. Wear a mask even. If you wear a mask and breathe warmer, more humidified air and protect your nose, that would make a huge difference. You're breathing humidified air, your body doesn't have to vasoconstrict as much. So that's another reason. Another reason is the viruses. People have lots and lots of viruses in the winter. There's the flu, there's colds, there's adenovirus, there's the normal rhinoviruses and coronaviruses that we get every year, not regarding the coronavirus 19, but just all viri that happen in the winter. These viruses and illnesses cause this inflammatory milieu. When people have a virus, their inflammatory markers are up. Your body's trying to fight. Inflammation is higher. And we know cardiac disease, and especially ACS, coronary artery syndrome, acute coronary artery syndrome, is an inflammatory disease. Same with strokes and heart attacks. Some kind of inflammation tips off this whole cascade. Blood thickens, platelets activate. They all stick together. They go down your arteries and they plug things up. So just make sure you understand that. That's another reason why these happen in winter. Another reason is people go out and shovel in the morning when their cortisol levels, which is a stress hormone, your stress hormones are higher, which adds to this inflammatory milieu. You are cold, you didn't wear enough gloves or boots, you are inflamed, you just had a cold or flu or whatever it might be. You might have had a sinus infection that you didn't know about, whatever it might be, and you're going out early in the morning. Oh, it just snowed all night. We're going to go out in the morning and start shoveling. Plus, you've been sedentary all winter long, and this is the first kind of activity that you do in a long time. So all of those things together add up to these winter heart attacks. And that's why we see more heart attacks in winter earlier in the morning when it's really cold out, you're not dressed appropriately, you may already have some underlying coronary artery disease or blockages and they're just not significant enough, but now they're revealed to be significant. So all of these things together make a difference. So what I usually tell people, and this was kind of the conclusion of the segment that Tony did on the news, is number one, warm up, stretch. Don't just run outside and start shoveling. If you haven't been active in winter, maybe start being active. Try to go to a gym or find some kind of activity that you can do to be more active. Number two, bundle up. Get really, really, really warm. Number 3, don't go first thing in the morning. Number 4 would be cover your face even, like get some humidified warm air. Cover all your extremities. Another thing is do it in spurts. Huge one. Go outside, shovel for 2 minutes, come back inside and warm up. Go outside again, 2-3 more minutes, come back inside and warm up. Do it in spurts. Don't go out there 15, 20, 30 minutes and be a hero. Everyone wants to be a hero. Don't be a hero. You do not need to risk your life for this. There are some people that probably shouldn't do this at all. If you're one of my friends, she's a doctor, she's really funny. She said, I tell my patients, if you're 35 and older, don't shovel snow. Well, I mean, if you're 35 and older and quite healthy and active and never smoked in your life, you're probably fine. But I would say probably 45 is a good cutoff for men, 55 for women. If you're a smoker or have been a smoker in the past, please be more careful. If you already have stents and had an abnormal stress test, or you get chest pain when you exert yourself, don't do it at all. Have someone else do it. Don't even use a snowblower. Let someone else be the hero, and someone else can do the snow blowing or the shoveling. Hope you enjoyed. Share this with your friends. Avoid the winter heart attack, people.